We're here today with Mr. Davenport. This is a follow-up video. He's about 10 months, I think,
Yes.
close, right?
Yeah.
10 months out from a custom prosthesis for a complex problem he had, and he's doing really well. And we just kind of wanted to show how well he's doing. So, show us how you're lifting your arm up. It's unbelievable.
It is.
And
It's
come
great.
on, that's awesome. Come on back down, and then his rotations to here, and then show us kind of in the back. Now that's great.
Yeah.
So his right shoulder actually had you can relax your left. His right shoulder actually had a replacement done about 14 years ago, and he's starting to have problems with that now too. But we'll look at his x-rays and I'll explain what was done. But show us your motion on your right shoulder. So yeah, his left one's actually better than his right, which is really great. So really excited about his progress and how he's done. I would say it's difficult to have this fantastic a function after such a big surgery and so many surgeries on your shoulder. So I'm really pleased with how this has turned out. So thanks for showing off for us today.
Yeah, thank you. I appreciate it.
Awesome. So here's some x-rays. Here's his initial x-ray before surgery. He'd had a previous shoulder replacement with plastic that was here that was taken out because it was loose, and then he had developed this significant amount of wear of his socket here. And you can see how his ball is really kind of moved in towards the chest. And we did the custom implant, and this is a picture here where all of this is custom metal that was designed for his defect, and we put the reverse in where a ball here and the socket went here. So that's this is what was done for him. Now when you look at his other shoulder now, unfortunately he's starting to get some loosening where this implant is starting to loosen. You see these lines around the plastic socket. So we're actually going to go in and take this out arthroscopically for him. I look forward to discussing the precision shoulder with you and how we can reduce your pain and get you back to the activities that are so important to your quality of life.